Welcome everyone to our third week of the Luminous Virtual Education Series. Before I introduce Dr. Ross, please be advised that all attendees' mics have been muted. However, you can ask questions via the question panel on your screen. Please do ask questions throughout the presentation as they'll form part of an interactive Q&A at the end of the session. A little bit about Dr. Ross. So Dr. Victor Ross is an internationally renowned dermatologist specialising in laser surgery of the skin, utilising a broad array of energy-based technologies. Presently, he is the director of Scripps Clinic Laser and Cosmetic Dermatology Centre and a frequent lecturer at both national and international meetings on cutaneous laser medicine and conducts research on novel approaches to skin rejuvenation. Dr. Ross was elected President of the American Society for Laser Medicine and Surgery, otherwise known as ASLMS, the world's largest professional organisation dedicated to promoting excellence in patient care, and was also recognised by ASLMS with the Carolyn and William Mark Memorial Award, as well as the Leon Goldman Award for his lifetime contributions to research. We are very honoured to have Dr. Ross present on the advanced intelligent skincare with the brand new Stellar M22 technology. And Dr. Ross, I'm going to hand over presentation to yourself. Thank you.
Okay, all right. Thank you, Tracy. We're going to go to show my screen here, and we're going to get right into business here. So I think we'll be okay. Let's see. There we go. So it's great to be here, and it's just afternoon here in San Diego. At the end of the day, the sun is setting on the West Coast, probably the opposite there. It's still kind of morning and midday. So lunch with the Stellar is a nice place to be. So we're going to go through the device and go through some of the advantages of this device versus the older M22. I'm sure some of you have the M22, the older version, which is certainly a good device. And this device really is an enhancement on that older device. So we're here in San Diego, and Luminous has been around a long time, really since 1995, and it's gone through some company changes over the years, but it's certainly been one of the older, more stated companies here throughout the world. And one of the things that Luminous really started was IPL, and IPL has been around now for about 25, 27 years. And one of the reasons that made it popular was it covers a large area pretty quickly with a large spot, and it was delegatable, and it fit into what people were doing whole areas to rejuvenate the skin. And IPL now accounts for about 500,000 procedures a year in North America. And most people do charge between about $300 to $500. We charge about $500 here, and if we add the resurface, which we'll talk about, we charge a bit more. So what's very interesting is the history of innovation with Luminous relevant to the IPL. So if you go back to 1993, they had the first devices that kind of came out, and IPL sort of had a mixed start because I think true laser zealots felt that maybe it was not ready for prime time. And in fact, it really was. What happened is the people who really embraced intense pulse light early, I think, found it was a very usable device. I still have a friend, Harvey J, up in New York, who uses one of his original IPLs from the early 1990s. So it really was a device that was misunderstood at first. I think more and more through the years, people have realized as the devices have gotten better, the cooling's gotten better, the filtering's gotten better, and the number of filters to do different applications. And also these platforms can drive other types of lasers, which we'll see with the M22 Stellar platform. These devices have become more popular and really now are a mainstay of a lot of clinics. So if you look at the old M22 to your left and the new M22 to your right, they're very similar. They look like cousins. They're not identical twins though. And the reason they're not identical twins is a few ergonomic upgrades with the M22 Stellar. One of the upgrades is you can hold the handpiece two different ways, which we'll show you during the little video later. It has a longer light guide. So the older light guide on the M22, the Sapphire light guide is almost like a pug nose. It's in the system and you have to kind of look around. The new one is more like a beagle. The snout is longer, so it allows for easier visibility, which is important for a long day. It has a larger graphical user interface. You see the small one to your left and the large one to your right. And to be honest, you don't realize how much you like the larger one until you go back to the older one. I had the older one and I thought, it's pretty good. Then I used the newer one, and then they did a software upgrade and I had to go back to the older one. Gosh, I felt like I was in a Lilliputian world, like going into a tiny world. So this newer interface just makes it so much less strainful for your eyes and your fingers. You can see everything, everything's easier to see. So those are the big improvements. And finally, it has a glove box that's worthwhile. I always complain about laser companies. You buy this big piece of equipment that's very expensive, and they don't even give you a glove box to put things in. This has a sizable container on the right to store things, goggles, manuals, things like that, which sounds trivial, but it's actually a big upgrade. So the nice thing about intense pulse light is the versatility and the range of conditions it treats. That really brings it into med spas, dermatology practice, plastic surgery practices, because you can do a lot of things with it. Now, frankly, some things you can't do, like tattoos and some body contouring, but really almost everything else except resurfacing, ablative resurfacing, you can do with this device. So hair removal, pigment, scar revision, even tattoo removal with the Q-switch laser. We can do tattoo removal, but not the IPL part. So if you look at the range of utility with this, from leg veins to small tattoos to red spots, brown spots, and rejuvenation and scars, it has a large range of activities that it can do. So I'm in a tough spot, like most of Australia, in the sense of tanning. So most of our patients, they're not necessarily tan, but they're bronzed year-round. So even in January in San Diego, where the weather typically is 65 degrees or maybe 20 degrees Celsius or 18 degrees midday, it's not cold and people are out doing things. So if I see a woman who wears a V-neck shirt, even in January, they're going to be slightly bronzed. So I do have to treat patients year-round who have slight bronzing. And the nice thing about the M22 is if you choose the settings correctly, you can still treat slightly tan patients even in the middle of summer. You have to be careful, but it can be done. So you really can treat a range of hair types for hair removal, a range of skin types for brown spots and red spots. And with the Resurfix, even if somebody has a tan, you can certainly treat scars and do some basic rejuvenation. So if you look at the four components, and there are four major components to this device, or four hand pieces that are sort of independent. The Stellar IPL is really probably going to do 70% of your work. It depends on your practice, but in our practice, I'd say that handpiece we use 70% of the time. You can slip it on and off, but that's going to drive all your major IPL accessories, the different filters, which we'll go through in a while. And then the red and brown dyschromia, you can do some of that with the Resurfix as well. Leg veins and larger vessels, you have a multi-spot YAG laser, which is independently attached to the device. And then you can use the Q-switch laser for some small tattoos and some pigmented lesions as well, and melasma for laser toning. So a large range of things it can do, over 30 conditions can be treated. So I can't think of a clinic that wouldn't use this. I always tell people when they say, what's the first device I should buy? To be honest, you have to have a device that treats red and brown spots. I think that's the most important thing for a first device, at least in San Diego, because I'd say 70% of our patients have some red and brown spots. I'd say 80% have brown spots. It's rare to find somebody in San Diego who's older than 30 who doesn't have a brown spot from the sun. So you have to have that. And again, the modularity of the system allows for the fractional handpiece, for the Q-switch handpiece, and the long pulse YAG handpiece, which means you can use it for almost any patient, unless you're doing some type of patient for body contouring, something that's a little oddball stuff. You can use this for almost any patient that comes in the door. So again, these are the four major components: IPL for red and brown spots, Resurfix, which is for the tone, texture, and scars, the multi-spot YAG, which is really for leg veins and maybe some larger vessels and large hemangiomas, and finally there's a handheld Q-switch laser for toning and tattoos. Now here's a little video that goes over what we found when we first started using the Stellar. I'm going to have some of my first thoughts, and this is probably after I had the device for about maybe a week.
So in comparing the older equipment to the new Stellar, there are some differences. The major improvements that the Stellar has integrated into the system is a larger, rapidly user interface, which is much easier, less eye strain, easier to touch the right spot and get the right settings. The main advantage I see are twofold. One is the protrusion of the light guide. The light guide actually now protrudes about 2 to 3 centimeters versus a centimeter, and that really allows for a lot better visibility. So the visibility is enhanced with the Stellar system versus the old M22, primarily based on the length of the light guide. So by having a longer light guide, you can see everything from further away. You can actually see around the handpiece, which tends to obscure your vision. And with the older M22, which was an excellent device, the snout was much shorter, so you had to kind of turn your head to the side. And that meant you had to slow down a bit to reassess more often, and there was more fatigue on your eyes as well as your hands. The other advantage is this handpiece allows for multiple ways to hold it, and it has basically 2 ways to hold it. You can hold it at the base, or you can hold it over the light guide. And so people prefer one or the other. I like holding near the back of the handpiece, and I think that allows me to see better and less fatigue on my wrist, but some people might prefer a different style of holding it. But the nice thing about this device, particularly compared to the old M22, besides the larger graphical user interface and the longer light guide, it is this ergonomic flexibility. You can actually now take your hands and use it different ways. You can go left-handed, right-handed, so it's very nice over the course of the day as far as the burden that you have as far as making sure everything's in the right spot.
So that's just a quick synopsis of what differentiates this newer Stellar versus the older M22. So the nice thing about this multi-application system, and I really can't emphasize this too much, is you have multiple revenue sources. You've got one device, so that saves space. You can do a lot in one visit. We oftentimes combine particularly the resurface with the IPL part to try to get reds, browns, tone, and texture all in the same visit, which is certainly doable and tolerable for most patients, just with some numbing cream. So again, why the Stellar in particular, but the M22 has become the multi-platform leader for most practices is it works, it's safe, it's delegatable depending on your state or your country, it's versatile, and it can be upgraded. So these are all the things that really make it stand out versus some other systems. And it's fairly movable. Although it's tall, it moves fairly easily. So if you have to move it from one site to another in a space in your room, or move it from one room to the other, it's not that difficult. And it also starts up relatively quickly. When you actually, I just turned it on right before this, and I realized in 3 or 4 minutes I was ready to go, maybe even a little bit less, from a cold start to being able to treat the patient, but relatively quick warm up there. So there are a lot of things that are treated with the IPL handpiece. This is my go-to handpiece because it can do everything from hair to spiders to port wine stains, angiomas, and mainly red and brown dyschromia. So it really does the whole gamut of things. And like I said, here in San Diego, probably much like Australia, a lot of people have red and brown spots, and they want to look younger by reducing the dyschromia on their face. So this is a list of the filters, or a slide that really shows the different filters. There are filters that go for acne, which are kind of a blue light filter, and then there are filters that go really long out to red light. So you can kind of pick and choose and cherry pick the wavelength range based on the filtering. And the nice thing about these filters, they slide in and out. It doesn't require a whole different handpiece, say if you want to do hair reduction or acne, which are on the opposite spectrums of the IPL output. There's also a dedicated vascular lesion handpiece, which we'll talk about, which is very nice for treating red spots. So again, all this is in one handpiece, 3 different crystals, very easy to change. And here's again the list of the different handpieces, 9 interchangeable expert filters, and they slide in and out literally in about 2 or 3 seconds. Very fast change, very fast, and the device realizes what filter's on there, so you get feedback with that as well. Again, there's the 3 sizes to the crystal, but there's also the 9 filters, and there are 3 light guides. So there's a large light guide, which is the standard 15 by 35 millimeter that you're going to use most of the time. That's primarily for the cheeks, the forehead, necks, arms, legs. And then if you want to go a little smaller, you can go to an 8 by 15. That's if you want to go into maybe some small areas in the mid cheek. And if you really want to get precise on an angioma or some small vessels in the concavities of the nose, for example, you can use the 6 millimeter round adapter. And again, the device knows which one is on there, and it'll give you recommended settings based on that size, because as you go to smaller sizes, you generally need a little bit more fluence to have the same real-time outcome or endpoint. So here's just some video showing red spots. This is a balloon video. The white is not damaged. There's blue and brown. So all three things can be treated here. Blue things, brown things, and red things. And that just shows how the light goes right through the white, which is not absorbed, which would be your skin. And of course, we'd be cooling the skin of the balloon with the M22 as well, with the cooling device on the surface. So the other thing besides the filtering that is nice is the pulse profile. In other words, the character of the light as far as the instantaneous power as a function of time. So there are different types of pulse technology. The luminous M22 uses this optimal pulse technology, which is a nice kind of square pulse. We'll show you this here. So in other words, the optical pulse technology goes across, and during the entirety of the pulses, you have a very uniform output, which keeps away this spiky output, which tends to overheat the epidermis. So a homogeneous squared off energy is going to give you more reproducible treatments. And again, the nice thing about the M22 is you can dial in and really design the pulse structure as far as one pulse, two pulses, or change the interval between the pulses to really dial in exactly what you need for the right situation. So the multiple sequential pulsing is important. It's built into most of the application-driven menus. There are very few single pulse algorithms with this device. Most everything is 2 or 3 pulses, and that's deliberate because if you're treating vessels in particular or hair, you really want to allow the epidermis to cool between the pulses. So imagine what's happening is the epidermis is going to be touching the cooling crystal. So with each mini pulse within the long pulse string, the cooling crystal is always there extracting heat. And if you have a break between those 3 or 4 pulses or 2 or 3 pulses, you get cooling of the epidermis, but you also get heating that's cumulative for the deeper structures. So what happens is those deeper structures, they do cool a bit, but because they're immersed in the hotter dermis, they're not going to cool as much as the epidermis. So as you go to these multiple pulses, what happens is you get selective heating of the deeper targets, whether that's a blood vessel or hair, and relative cooling of the good guy, which typically is the epidermis. So here's one pulse, there's a delay, a second pulse, a delay, and no matter how many pulses you put in, that delay allows for cooling of the epidermis. So here are just some representative photographs. Telangiectasias do very well. These are from my friend Mary Lupo in New Orleans. Here's another patient from Dr. Monavali in Charlotte. You can see the redness before and after. And here's my own patient I just treated about 3 weeks ago. Actually, it was just before the pandemic, so I guess it was more like 6 weeks ago. But if you see here, these are 2 little angiomas. And what we did is we treated him with the 6mm spot vascular handpiece. We're able to make it basically go away. This is him about 2 weeks later. Here's a little video showing a angioma being treated with a 6mm handpiece. So what we do is we take the 6mm handpiece at about 28 joules per centimeter squared. We give her a little pulse, and it turns blue, and in about 2 weeks, it will go away. So the nice thing about the small little round handpiece is twofold. One, it allows for ergonomic simplicity. The visibility is exquisite. You can put it in any nook or cranny. Oftentimes you'll get little hemangiomas near the hairline. This is a nice way to get in the hairline and not damage a big area of hair. Also for some tan patients, if they have a larger hemangioma, you can treat this and not expose the entire skin to a big spot, like a 15 by 35mm spot. So this is nice for doing fine work, doing some weed eating instead of mowing the whole grass. Now here's my own patients. This is an angioma just before treatment. This is right after treatment. Again, it gets kind of blue and small, and then it will disappear typically in about a week or 2. Now we did a little study, and we're going to present this again in a couple of weeks at the virtual ASLMS meeting that we are sort of having. And what we want to do is see, can we compare the intense pulse light device to a 532nm laser in small facial vessels. So what we did is we randomized patients to the left and right, and then we treated one half with the long pulse KTP laser, or frequency double YAG laser, I should say more perfectly, versus the Stellar M22 with the vascular filter. So we'll go into that. This is the little video again showing red going away, and certainly that would happen with a KTP laser as well. Now what's interesting is if you look at KTP, it's at one of the absorption peaks for hemoglobin. So if you look at this graph, the x-axis is the wavelength, and the y-axis is the relative absorption by the various chromophores. So in our case, we really are concentrating on the hemoglobin, which has a peak at about 540 nanometers and a second peak in the yellow light about 575 nanometers. So KTP is nice, but if you look at the structure of the M22, which we'll show in a second, it has a double notch filter, which gets all of this, the entirety of the yellow-green hump, and there's a second hump out here near 1064. So it really takes advantage of the entirety of the hemoglobin absorption spectrum. In fact, the vascular filter really attempts to mirror the absorption spectrum of blood with its emission spectrum. That's what you really want. So what we did is we looked at this, we used the 3 waveguides with the M22, the large, the medium, and the small, and compared it with a competitive KTP laser. And here's the KTP laser, and you can see it, it'll work. You can see the crystal, and you'll see the vessels disappear. So this is something we see with KTP. And then the next video will show the M22. So here's the M22. And we'll place the waveguide against the skin, voila, and you'll see the vessel just disappeared. So just like a laser, the IPL can do just as good a job. And the nice thing is, let's say this patient wanted to do hair reduction, or she wanted to do her chest and her arms and her legs for brown spots. All you do is slide filters in and out and do it. You don't have to go to a whole different product. So that's the advantage. You could argue these two devices are similar for vessels, but if one device can do more, it would make it a better product overall. So here's just some before and afters. This is the IPL before and after using the small rectangle spot. Very nice before and after. This is the KTP side, also good. This side, the right side of this patient, we treated with the KTP laser before and after, and this is the IPL with the vascular M22. So you can see it's almost equivalent. You really, at the end of this treatment, you really could not tell me which side was treated with which. This is the M22 Stellar with the vascular 8 by 15 millimeter crystal and vascular filter just before and after my own patient. This is a patient we just treated about 6 weeks ago. And what's interesting about this patient is I also used the AccuPulse on the nose. So we used the AccuPulse on the nose for rhinophyma. So this is right after the treatment. We did telangiectasias with the M22 with the vascular filter, and then the AccuPulse, another luminous product for the rhinophyma, and that's him right after. Look, the vessels just disappeared there. And here he is before, and the rhinophyma is also better too. This is about a month later, so the rhinophyma is much better. And look at the vessels in front of his ear, they're almost completely gone. So again, by using 2 luminous products here, you can get really nice results for both rhinophyma and using the M22 for the vessels. We also did a little modeling. So we did a model comparing the IPL, the M22 for a vessel. So this is a little complicated, but we placed a vessel 500 microns in the skin, and it's about a 200, 300 micron vessel. And we looked at the heat profile of that vessel where I'm circling here. We compared it to KTP. Now they both heated the vessel, but you see with the IPL, there's more uniform heating because with IPL, with the Stellar handpiece, you're using more wavelengths. So you have more opportunities for interaction between the hemoglobin and the blood vessel. And now you can capture the heat at the deepest part of the vessel and not just the superficial crescent of the vessel, which we did here. And here's that notched filter I was talking about. This is the output of the notched filter, which is the vascular filter to your left on this handpiece. So it encompasses both peaks in the green yellow, which is 530 to 630, and it also uses the second hump. So the vascular filter really exploits the absorption spectrum of hemoglobin. So in the results, we basically saw the same for both devices. Here's some more. This is pigment. So you see pigment before and after with the M22 Stellar. That's Dr. Remington up in Canada. Here's my own patient. We just saw her about 3 weeks ago. We actually treated her right after the problems with the pandemic, but we squeezed her at the very end. This is her 20 minutes after using type 4 settings, the 590 nanometer filter with the M22. And this is her about 3 weeks later. So this is before and about 3 weeks later. Yeah, there's still some pigment over there, but this is one treatment. I think she got nice results for one treatment. We were trying to be safe. And this is our typical San Diego patient. This is her in March. Now, so at the end of the winter in San Diego, and I guess this would be like maybe November in Australia or September, what happens here is you see there's still a line of demarcation between this sort of tanned and untanned skin. So we're constantly dealing with this with San Diego. My colleagues in Boston, their skin really never looks this bad unless they go to the Caribbean or something during the winter. So we have a tough time. This is only one treatment, very nice results. And with a second treatment, we could mop up the rest of that by going to probably to type 3 settings with the M22. Here's another. This is from Melanie Palm, one of my colleagues about 5 miles from me, using the M22 for pigment. Hands you can do as well, Dr. Nazar, and this is, again, pigment. You just have to choose the right settings. For her, I'd probably use type 2 non-facial lentigo settings, and you get nice results with that with a 560 nanometer filter. This is my own patient. I saw her right before the pandemic, Asian patient with really kind of type 3 skin. This is after one treatment with the M22. I treated with the type 4 settings, but I probably could have treated with type 3. I left a little bit on the table here. Some of these pigment lesions are a little low contrast still there, but she was very happy with the results for one treatment. I thought it was a pretty darn good results with the M22 Stellar. So when you do the consult for IPL, the big thing is assessing not so much the skin type. I don't like to harp on skin type, it's skin color. Color matters more than skin type. You get into trouble if you rely on skin type. If somebody's been tanned and they're type 2, you really have to choose type 4 settings. So it's always tricky. But you can plan on multiple sessions. I have to tell you, when I do the IPL, and my colleague Mitch Goldman is sort of the same, we push pretty hard. I do the treatments myself. I oftentimes will do a test spot when I put the numbing cream on, and then evaluate that 15, maybe 30 minutes later when I take the numbing cream off. And that allows me to kind of see where we are. I use that as a little test. And so I try to push the envelope to get as best results I can with one treatment. You certainly can do more treatments. We can do touch-up treatments. I think the key thing is realistic expectations, that when I show patients before and after results, I show them pictures like the ones I showed earlier where there's still some lentigines that are left on the table at the end of the treatment, because we have patients who, even though I do that, I show them pictures. We have our handouts which tell us everything about the reason they might need multiple treatments, or not every lesion will go away. They continue to say, oh, Dr. Ross, you said every lesion would go away forever. And so no matter what you do, I think some patients will say that, unfortunately. So the next handpiece, and this is one you'll use probably second most, is the Resurfix handpiece. This is a very nice non-ablative fractional laser, 1565 nanometers. There's no consumable. It nicely complements the IPL portion of the handpiece, or you can just do it alone for scars and pigmentation to some degree, and for just general rejuvenation. So it's very nice. There are lots of combinations of different scan patterns, sizes. Continuous contact cooling is involved. We sometimes use Zimmer air cooling in addition, just to make it more pleasant. Again, no consumable. It's a 1565 fiber laser. It's very easy to use. No disposables. I can't emphasize that enough. And so this is a true fractional non-ablative laser, and we'll show a little video of how it works. These are different patterns you can have. You can really design almost any pattern, like the old spirograph. Typically, one pass coverage can be up to 20%, and with other devices, it can be down to 6%. So the nice thing about the Resurfix is you get a lot of coverage in one pass. And of course, that depends partly on how you set the density. The density can be very low or very high. Most people, we're going to use between 200 and 300 spots per centimeter squared, which gives you roughly about 15 to 20% density per pass. Here's a little video showing how it works. It has this scanner right here. And now you'll see the interesting about the scan. So the scan, rather than placing the dots contiguously, it randomly places them in a pattern that's really a random pattern. And in that way, the dots aren't hitting the same spot next to each other. So pain is diminished, because the pain fibers are sort of confused because there's so many different dots being hit in a random pattern like that. You can see it fills it up. And with cooling, it makes it very tolerable. Here's again why it works. Here goes before, and then it slowly fills up the scan pattern. Each scan takes anywhere from like a second to about 5 seconds. It really depends on the size of the scan and the density. So applications, the Resurfix, scars are probably the #1 thing. It certainly can reduce pore size to some degree. You can use it for wrinkling, and melasma, melasma is always tough. You can use it as a complement to other therapies for melasma. We generally want to use creams first, like hydroquinone, bleaching creams, but it helps with melasma if you're very conservative and be very careful. Here's a patient from Dr. Clementoni, and you can see before and then after the resurface. This is 3 treatments, and oftentimes we do combine it with the IPL. I think you get more bang for your buck if you combine them. These are some scars from Dr. Clementoni again, and oftentimes we'll combine this with the vascular handpiece. Now, one problem with the vascular handpiece on this gentleman, you want to use the smaller sapphire crystal so you don't heat the beard hair. That would be one thing to think about with somebody like him. This is a typical scar. Again, this is just pure resurface, 1565 nanometers, multiple sessions, a very nice result. And there's a big push for fractional ablative lasers, and I know that Luminous makes 2 excellent ones, the Ultra Pulse and the AccuPulse, but I have to tell you, I do a lot more non-ablative fractional for my scars, mainly because it's just easier to do, the pain's less, and there's no open wound. Even the slight open wounds with the fractional ablative are a little tougher to deal with. So again, this combination called photofractional is very popular, and when we do that, we add a few $100s to it. So if we just do the IPL alone, we have a price, and if we do both, we add more because it takes longer. And you want to do it relatively briskly. The longer the procedure takes, the more the numbing cream tends to wear off. But these procedures are tolerable so long as you use some numbing cream, a little cooling. Some people can get through the IPL part with no numbing cream. My experience is that patients certainly prefer numbing cream and are more likely to come back to your practice if it's a comfortable experience. So again, the consult, find the patient, what they're in for. If they're predominantly red and brown spots and not a lot of scarring or tone and texture, we'll just use the IPL alone. If they also want a little tone and texture improvement, we'll use a combination. Now, one thing I have to tell you, if somebody has no red or brown spots, you don't want to use the IPL alone. And I see people come from spas sometimes and go, well, the IPL didn't work. And I look at them and they have no red or brown spots. And I said, did you have them before? No. So you have to really be careful. For those few patients that really don't have red or brown dyschromia, you don't really want to go with the IPL as a first therapy. And that's where the resurface comes in handy, because those patients who can't use IPL, they can almost always use the resurface part of the M22 platform. So again, the cream is on for about an hour, and the total procedure takes about 20-25 minutes, sometimes 15. It kind of depends on how the settings are for the resurface, which is going to take the longest part of the time. And post-operatively for these patients with the photofractional, it's almost the same as you do with the IPL alone. You can certainly use some steroids temporarily. A lot of cooling is helpful. I just treated my wife with this Sunday a week ago. She had some swelling, but not a lot of pain. The swelling is something that's a little unpredictable. Some people get a lot of swelling. Some people get very little swelling. So the third component of this device, and this one you won't use probably as much as the other two, is this single application YAG laser. And this YAG laser is a long pulse YAG laser. The fourth component we'll talk about is a Q-switch YAG laser. So this is a long pulse YAG laser. The pulses are on the order of tens of milliseconds, and there are 4 spot sizes. And it's really for either nodular lesions, bigger vascular lesions, vessels and darker skin, or leg veins. This is really the application for this. So when it says port wine stains on this slide, you really wouldn't use this for a pink port wine stain. You would use this in conjunction with IPL or another laser for the nodular, thicker components. So here you see the handpiece, and it's basically a handheld handpiece, and there are 4 little crystals here. There's the 2x4 millimeter rectangle, a 6 millimeter spot, a 9 millimeter spot, and a 1.5 millimeter spot. These are the light guides that go with it. They just pop right in there, and they're cooled down. And you can set the sequential pulsing again, the pulse profile, to get nice cooling of the epidermis and heating of the dermis. Now you have to be careful with this wavelength. That's true for any neodymium YAG laser from any company. I think it's a wavelength you have to respect. You have to learn how to use it slowly. Again, you don't want to use this willy-nilly on very flat port wine stains. This is primarily for larger vessels for the most part, although you can use it for smaller vessels. You have to be careful with it. So again, for very small types of application, you use a very small spot for very small leg veins, and then for the larger tip, you can use for larger vessels. So I always try to use the smallest spot as I can to actually mask the heating to the peripheral skin. Here's a patient with Dr. Clementoni. He used a variety of handpieces. He used a 590 nanometer filter for the flatter part, and then he used the YAG for some of the thicker parts, and that's a good combination to use for port wine stain. Dr. Goldman treated these little vessels with the YAG handpiece. Now, this would not be my first choice. Dr. Goldman's an expert. He's used this device in one form or another for probably 20 years, maybe even 25 years, going back to the original device in 94, 95. And these settings are reasonable, but I will tell you that I would probably use the use the vascular filter with the IPL on somebody as light as this. Now, if this patient were darker, you could certainly use this handpiece, the YAG handpiece, and it is safe in Dr. Goldman's hands, but again, you have to be real careful to cool a lot when you're treating these small vessels with the YAG handpiece. Now, the last part of this laser really takes it all the way around, so you really cover all your bases here, is the Q-switch YAG component. This is a YAG laser. It's just 1064 nanometers. There's no frequency doubling, and there are different spot sizes. There's basically 4 disposable tip spot sizes, and there's a 6mm tip for skin toning. And what you do with this device, it'll go up to 5 or 6 hertz. Relatively low fluence is about 1.5 to 5 joules per centimeter squared, depending on the spot size. And you go back and forth for laser toning, and you can also treat some tattoos and some nevus of odor and things. So this is a patient with a tattoo after 9 treatments. Tattoos do take a long time to treat. You can combine tattoo treatments with the microdermabrasion and also the resurfix for some stubborn tattoos. And here's a patient for some melasma treated with laser toning. Now, laser toning is where you take a low fluence Q-switch YAG laser and kind of go back and forth over the skin. It does work. You have to do multiple sessions, but I will tell you, you have to be careful with it. It goes real low fluences, and there's also a risk of rebound. There's always a risk that rebound can occur with that approach. So again, the fluence is going to be very high, but that's only with a small spot. It's a little top hat pulse profile, about 5 nanoseconds, and there's a lot of different spot sizes you can use to get different effects. But it's a nice handheld Q-switch YAG laser. It's not going to be like the Pico 4, which Luminous also has, which is a high-powered Q-switch Pico laser. But this is a nice laser if you treat occasional tattoos, you want to do some laser toning. It's nice to have this as an option for the M22 platform. Here's some laser toning on the left and before and after. So melasma, as you know, is hard to treat. I don't have any magical recipes to give you for melasma. I do different things. I generally do a little fraction, a little IPL, a little creams, a little sun protection, but everything is challenging, and melasma tends to be a chronic condition no matter how careful you are. Here again, some laser toning before and after. So that's the talk, and again, we have the 4 handpieces, the IPL handpiece with the multiple filters, which is going to be probably, like I said, maybe 65, 70% of what you do, another 15 or 20% with the resurfix, and then the niche players are the long pulse YAG and the Q-switch YAG, which you're going to use kind of depending on what other lasers you have in your practice. And they can be used as much as maybe 10 or 20% of the time. Again, it depends on what else you have. I don't know if people have specific questions. We certainly have a little bit of time here. We're 40 minutes into it.
Thank you, Dr. Ross. At this point, I would like to introduce Rhiannon Mitsopoulos, who is the National Clinical Educator with Luminous, and Rhiannon is going to moderate the Q&A session. We do have a number of questions that have come through. Thanks, Rhiannon. Rhi, you're on mute.
Chatting away silently for everybody. Thank you so much for your presentation. That was absolutely fantastic. And I cannot wait to get back to Sydney to get my hands on the Stellar and give it a good try. So we have got a number of questions that have come through. The first question is, hi doctor, thank you so much for the presentation. For cases like phytomas rosacea, what treatment interval time between IPL and CO2 would you recommend? Phytomas rosacea.
Oh, phytoma. Okay, so, well, I mean, yeah. I mean, I guess if you're referring to the rhinophyma, yeah, that's a good. So most patients who have rhinophyma also have blood vessels on their nose. and some will even have almost a rhinophymatous condition of their cheeks. Of course, we try to use as much medical therapy as we can for the inflammatory part of rosacea, whether that's doxycycline, minocycline, and then there's all kinds of creams, ivermectin, azelaic acid, metronidazole, all those things. But if we can control the inflammatory part of the rosacea, the next step is to treat the redness. So normally I would treat the redness first, and that would be with the IPL handpiece. If somebody has very thick vessels, I'll use the long pulse YAG handpiece. And once we clear the vessels in 1 or 2 treatments, then we'll proceed to do the rhinophyma with a CO2 laser, the actual phymatous part, or the sculpting, the laser sculpting, so to speak. Now, sometimes we'll do both at the same session. We'll actually do the M22 IPL first and do the AccuPulse in the same session.
Do you have the AccuPulse and the UltraPulse in your practice, or just the AccuPulse?
I do. I'm very fortunate. I have both, and we use them a lot. So yeah, we have both. In fact, we did a little mild rhinophyma today on a woman, which is rare, and we use both the UltraPulse and the AccuPulse. It kind of depends on what room I'm in, but they both can do the job.
Yeah, absolutely. And I find if I'm doing a similar case and I've just got a couple of little tellies, I find that by doing the AccuPulse or the UltraPulse, that it coagulates those little blood vessels anyway. So I typically would do the IPL prior if they're quite significant.
Yeah, if you go deep enough, you'll get the vessels with the CO2 laser. You're right. What's bad is if you hit a vessel in the middle of the CO2 laser, sometimes it'll bleed and you have a little trouble stopping it. So it is nice to use the IPL or long pulse YAG prior to that.
Definitely. Got a couple of questions about the Resurfix and how successful is the Resurfix at treating pigment? And I'm going to go with a two-phase to this question: superficial pigment and then dermal pigment, and how successful the Resurfix is.
Yeah.
Or maybe it not be the right treatment.
Yeah, I mean, that's a great question. So it's funny, when you go back to the early days, and we'll just talk about Fraxel in the early days, the original fractional laser, as far as non-ablative in 2003, if you look at pigment improvement, and there was this lady, she went all over the country. They actually brought her to meetings in the early 2000s, and she had like 8 or 10 treatments with the original fractional 1550 nanometer device, and she actually had pretty nice pigment improvement. Most of her pigment was epidermal. I think she was like 62 years old. But what was happening was they were getting about 20 or 25% coverage, maybe 30% at the most with that device, and she was doing multiple sessions. And it is true, if you do enough sessions with a fractional device, even 1565 or 1550, you'll eventually get pigment, just because random chance you'll remove some of the pigment. And that's mostly going to be epidermal pigment. Certainly as you go deeper, you can get some dermal pigment. I can remember when the original fractional device came out, there was this magic, and everybody thought it was going to get all that dermal melasma pigment. And it did seem to do it at first, but what people didn't know at first, and which we know now, and it's true for all melasma therapies, the very treatment for melasma creates inflammation, which tends to promote more melasma. So I'd say the pigment it works best for is epidermal pigment. It can work for some dermal pigment if you have stubborn pigment, maybe after a traumatic injury and you have a traumatic tattooing. You can use the Q-switched YAG on this device and complement that with the Resurfix to get that stubborn dermal pigment out. But I think it really shines more for scars and tone and texture than pigment, because when you have the IPL with the Resurfix, you can get a lot of pigment with one pass with the IPL. So I don't rely on the Resurfix to do my pigment bidding for me, so to speak.
Yeah, absolutely, and I would agree. And I think if you just have a look at what you're trying to treat, you know, if you're doing something in a fractionated mode, especially over a solar lentigo, you're not going to get that whole lesion.
That's right.
So IPL is definitely what I go for first, and then I do the photofractional facial like yourself for all of obviously your texture at the end. What would you say the average downtime of your Resurfix clients would be?
Yeah, that's a great question. Yeah, because it really varies so much. If you do the vascular handpiece and the 560 handpiece on the IPL filter and the Resurfix at the same time, and you have a patient who tends to swell, it can be a good 5 to 7 days. It's the swelling that's the worst, and you don't know if you're going to get that swelling. So if you don't get swelling, it's only like maybe 1 to 3 days. People look a little beat up. Of course, the lentigines have the coffee grounds, but it's the swelling to me that makes patients unpresentable, because I have patients who have IPL alone and they get some swelling too. And if they don't get swelling, they can go back and do things. Now they're not going to be able to necessarily look great for a social event or give a big presentation, but the resurface adds a little bit more to that swelling. And so that's the main thing we have to counsel people about. And we've done everything to try to do a preemptive strike on swelling. We've done antihistamines, non-steroidal anti-inflammatory agents in patients who swell a lot. We know that from a previous treatment. We'll even pre-treat them with prednisone, usually 20 milligrams before and after the procedure. But sometimes you still get swelling. So it's the swelling is a little bit of the wild card.
Yeah, and it's just so unpredictable. But I think one of the things that I love about the Resurfix is that it is customizable. And if you do have a patient or a client, for example, who doesn't want that 7 days downtime, you can adjust your energy and your density to either make it a less aggressive treatment or a more aggressive treatment. So I love that about the Resurfix over other fractionated lasers, where you pretty much can't adjust your density. All you can change is obviously your energy levels.
And I will tell you, it hurts less than the rolling fractional devices. So if I did one side with the Resurfix and one side with the more traditional fractional 1550 nano laser, I can tell you 9 out of 10 people would say the rolling device that rolls back and forth hurts more. The nice thing about the scanning device with the Resurfix is, first of all, there's a break because you move from scan to scan, and within that scan, that cool scan technology really does allow for some cooling between the dots. So, and it does hurt a bit. I'm not saying it's painless, but for example, if I did the Resurfix on my left forearm right now and did the other competitive device on my right forearm, I could tolerate the Resurfix with no numbing cream. I wouldn't enjoy it, but I could do it. But I couldn't tolerate the other one. It would be like a bee stinging me. I'd pull my arm back. So there's definitely less pain with the Resurfix versus some other competitive devices.
I think as well that continually rolling backwards and forwards over an area as well, it does get to the point where it just becomes uncomfortable and intolerable. So that TrueScan technology is brilliant. Do you have much experience with skin needling? I've got a couple of questions regarding, the effectiveness of skin needling versus Resurfix.
Yeah, that question comes up a lot. So we have microneedling. We have 2 of the pins, the Eclipse pin and the skin pin. There's only 2 approved in the United States now. But we use microneedling. I'm not a huge fan of microneedling. It does hurt less, and it's easier in the sense that most patients can get by with just a little bit of numbing cream. But I just don't find the results to be as good as the Resurfix device or other kind of heat-based non-ablative fractional devices. And I just think the heat plays a role. Now for melasma, maybe not so much so, but outside of melasma, I think the heat really plays a role in getting more bang for your treatment session. Because if you do microneedling, yeah, you can do it every 2 weeks and probably eventually get near maybe what you get with the Resurfix after 1 treatment, but it's gonna take a lot more treatments to get there. And I just don't see the great results. Some of my colleagues are really enthusiastic about microneedling. It certainly has a role. Like I said, it's relatively easy. It's relatively painless, so like for stretch marks and things, but I just haven't seen the improvement I've seen with non-ablative fractional lasers.
Yeah, no, I would agree there. We've got a couple of people just asking what the main differences between the Q switch and the ND-YAG handpieces are.
Okay.
They've said they're both a little bit of confusion. They're both 1064 nanometers. So how does one target vascular and how does one target pigment?
Well, that's a great question. So they both have a similar rod. They're both little small neodymium YAG rods. And so when you hold those handpieces, you're holding the laser in your hand. The laser rod is actually in your hand in that handpiece. The difference is one has a quality switcher, which is a Q switch, and it actually shortens the pulse. So the difference is the pulse duration. So the Q switch laser is putting out pulses about 5 nanoseconds long. The long pulse YAG with the crystal, the cooling crystal, it's on the order of tens of milliseconds. So it's really 1,000,000 times longer pulse. So a millisecond is 10 to the -3rd second, and a nanosecond is 10 to the -9. So it's 6 orders of magnitude or 1,000,000 times longer with the long pulse YAG. So the long pulse YAG is really mainly for vascular lesions because the thermorelaxation time of most vessels is in the order of tens of milliseconds, whereas for tattoos, it's on the order of nanoseconds and even picoseconds. So that's the difference. So, and you'll see the fluences scale accordingly. So when you're using the long pulse YAG laser, the fluences are typically on the order of 60, 70, 80 joules per centimeter squared. We're using the Q switch handpiece on the order of 1, 2, 3, 5 joules per centimeter squared. So it's a less fluence, shorter pulse, certainly not very painful with the Q-switch YAG, and it's really just for laser toning, tattoos, and maybe some mild pigmentation disturbances. But they're the same. They share the same wavelength, but that's about it.
Yeah, perfect explanation. We've got a couple of people asking about, obviously the M22 and the Stellar has 4 modalities that you can choose from, and they're wondering what hand pieces you would start out with for a new clinic. So new clinics opening up, what hand pieces would you start out with? Would you go for the M22 fully loaded? Would you start out with the M22 IPL and the long pulse YAG or Resurfix? So your advice on a new clinic.
Right. Well, that's an easy one for me. So the number, if I had to choose 1, 2, 3, 4, I would choose the IPL first. I would do the Resurfix second, which is kind of hardwired into the system. And to be honest, I'd probably do the Q-switch YAG third, and then the long pulse YAG fourth, because I think if I looked at the number of times I'd use the long pulse YAG, it would be less than the Q-switch YAG if I didn't have any other systems. So this is based on me this is the first system I'm buying. I don't have another Q-switch laser in the background. I don't have a Pico 4. I don't have another long pulse YAG in the background. That would be my order. I would go IPL, Resurfix, the Q YAG, and then the long pulse YAG.
Yep, I would actually agree. And I think now that they've brought out the vascular filter and the 6 mil light guide, there really isn't too much vascular lesions on the face, including port wine stains that I can't shut down. So I really use my long pulse, for lower body, vascular lesions on the legs.
Yeah,
you would
give up the vascular lesions on the leg if you gave up the long pulse YAG. But frankly, I do 90% sclerotherapy there because of the pain issue, so it wouldn't be a big loss. I don't.
Yeah. In regarding long pulse YAG on the lower limbs, do you get a lot of hemosidian staining? And if so, how do you treat that?
Yeah, that's a good question. So I get that with sclerotherapy too. And typically larger vessels will cause more of that than smaller vessels. There's just more hemoglobin and more hemosiderin and more very superficial phlebitis with a larger vessel. And so time is the best ally. Time oftentimes will make it go away. If time doesn't work, then I always use a Q-switched laser. Typically Q-switched alexandrite, to be honest, is what I use, or Q-switched ruby. I only have Q-switched alex. That's my first go-to. You can certainly use the Resurfix with a small spot. You could even use the IPL with a small spot, but I really rely on time for the most part. Now, if you do bigger vessels, that staining can last for a long, long time, even over a year in darker skinned patients, and that's a hard thing to treat.
Yeah, unfortunately is. You take away one problem and kind of give them another one. Got another question about the skin needling, and could you use IPL to heat the skin prior to doing skin needling?
In the same session or different sessions?
Yeah. I'm assuming that they mean in the same setting. So you do an IPL session first, and then you do needling.
I mean, for example, if you chose, for example, you didn't have the Resurfix handpiece, you certainly could do the IPL and do micro needling right afterwards. It'd be a little bloodier at the end of the procedure, but that would stop in a few hours. Yeah, you certainly could do that. If you wanted to get sort of tone texture and red and browns in the same spot, I think that's doable.
Yeah, absolutely. When you treat your darker Fitzpatrick's with the Stellar, I saw that you had an Asian skin type and she had an amazing result in one treatment. How do you manipulate your settings in order to treat safely? I know it's a plug and play system, so you can simply select Fitzpatrick 3, Fitzpatrick 4, and it's going to adjust the settings. But I get asked a lot, people being a little bit uncomfortable treating those darker Fitzpatricks or those Asian clients. What sort of advice could you give, operators in the ease and the effectiveness and the safety aspect of the M22 and Stellar?
Yeah, I mean, the big issue there is I think calling the skin type right, but more importantly is calling the sun exposure right. So if you have like the lady I just showed was an Asian patient, but she was really good about the sun, and her skin really wasn't that dark, and she really, like I said, could have tolerated the type 3 settings, but I used type 4. I think where people get into trouble, they have a darker, say, Filipino patient or a Malaysian patient that's really darker, and it's really more type 5 or dark type 4. or they're tanned and they're type 3 or 4, and they use the type 3 settings. That's where you get into trouble. I think when I've seen trouble, myself and in legal work I do occasionally, it's not that the doctor used the wrong skin type setting. They used the skin type that was correct based on a questionnaire. They just didn't realize the patient is tanned on top of the skin type. So to me, the most dangerous patients I treat, frankly, are sometimes tan Caucasians or bronze Caucasians, because if you just go to the skin type, oh, she's skin type 2, but maybe she has a bronze chest like the lady I showed earlier, and you don't account for that, you're going to get into trouble. You're going to get striping and maybe blisters, and even the worst case, very rarely scarring. So I think that's more problematic. My darker Asian patients, I'll use type 5 settings and even melasma settings for pigment, and that works pretty well. And you can use the small spot for some higher settings if you have some stubborn lentigos with the 6mm spot. So a lot of creative ways to get around it. But the best thing you can do is do a test spot right when the patient comes in with that numbing cream. You can take a little template. I don't know if people can see me or not. Probably not, but I have a little template in my hand.
No,
and it
we
has
can see you.
Oh, you can see me, good. So I have little holes in here,
Yeah.
and I use this. So when the patient comes in, I'll take the template, I'll put it up against the skin, and I'll have the nurse put the numbing cream on. We'll bring them over the M22. I'll do a test spot, maybe move them back to the waiting area, and then we'll see how it does. And if it looks like it's appropriate,
Yeah.
I'll use those settings, because that's the best guide as far as how you do. Because I've been tricked before. I've seen some patients where I thought they were darker or lighter than they were, and if you undertreat, you're a little disappointed. You know at the end of the treatment they're not getting red, they're not the pigment lesions aren't darkening up, and you know when they leave they're probably going to be disappointed. Of course, that's better than having an angry patient. If you overtreat them, they're going to be angry. So I think you should have 1,000 disappointed patients to every 1 angry patient. So you can always bring them back and retreat them. I don't think anybody's going to go around and say you're a horrible doctor or a horrible nurse, or if you undertreat, they may say, well, they get their money's worth, but if you bring them in for a touch-up, give them a little discount or free treatment, they're going to be more likely to say good things about you than if you burn them. If you burn them, they walk around for months with these stripes, and they're going to ask who did it, and they're going to say your practice, and that's not going to be good for business.
Yeah, absolutely. Whenever I'm teaching, I always say, you know, there's 2 parts of a test patch. The first part is to make sure that nothing, you don't get any adverse reactions or nothing untoward occurs. And then the second part is to make sure that we get the right settings and that we're going to get that clinical endpoint. And the end user, the client, the patient is going to get those results. So I think test patching is absolutely huge and important. Just quickly, one last question. Got a lot of people who've got current M22s, and they just really want to know, you know, how much better the Stellar is, how much faster it is. Pretty much they want to hear from you on that part of things, and then we'll wrap it up.
Yeah, I mean, that's a great question. It is a tough question to answer, because if you like your M22 and you're happy with it and it's merrily going along and the water pump's not going bad, it's a very durable device and things are good, it's not going to be like you're going to walk into this thing and say, gee, this is like a 10 versus a 2 or something like that if you're rating some other device. I think what you'll find, what I found, again, because I had the old M22 first, and they brought me the new one, and then the new one had to go into service for a while, I kind of forgot how much I liked the snout, the handpiece design, and the larger interface. I have to tell you, the thing I probably enjoy the most is the larger snout and the interface. The ergonomics of the handpiece to me were okay before, but I think those 2 things are nice. I really like the longer snout on the Sapphire, the longer, more protruding, because you can see better. It's easier to see, which is I really like. I don't like when the handpieces are recessed into the crystals in the recessed into the plastic. It's just hard to see. And that large interface is nice for eye fatigue. You never hit the wrong button. You've got, it's almost like those old person smartphones you can buy for your grandmother or something, where you can see everything, you know, even if you're half blind. So it's kind of neat. But again, it's not a game changer. It's not, you're going to say, gee, this is, I'm going to be honest with you, it's going to be like, okay, this is 100% better, because they both share a lot of the underpinnings between each platform. But I think you'll find the bigger compartment, the ergonomics, the snout being longer, or the protrusion on the handpiece, and the GUI being better, you'll enjoy it. You'll enjoy it more the more you use it.
Yeah, absolutely. So I think those M22 users who already have them and, you know, don't need to upgrade, they're not really missing out on anything. I mean, the insides, you know, are exactly the same, but those who are going to be purchasing a new device, I mean, they're just so fortunate that they've got the Stellar and all of those advantages that you've just mentioned. I'm certainly looking forward to the longer light guide itself in particular. Just one more question's come through.
Sure.
After clearing surface pigment, what is the best go-to for lighter, deeper pigment with IPL?
So after, I'm sorry, I couldn't hear that last part. You remove some of the pigment, and is a deeper pigment you said, or
No, so she just said here, after clearing surface pigment, what is the best go-to for the lighter, deeper pigment with IPL?
so you remove some of the pigment and now you have lighter pigment. So you're talking about low contrast lesions, like they're is that what you were talking about?
Yep.
Yeah, okay. Yeah, that is tough. So once, you know, the first IPL, if you do a series, always works the best because you're always picking out the low-hanging fruit, the high contrast lesions. And when they get lighter, what I like to do is use the smaller spots, because if you use the smaller spots, you can really go right after those spots and use the Lentigo settings, which are a little higher, and just place that little 6mm crystal. I usually use that versus the 8x15, and place it right on the Lentigo. And again, you can use the little mask if you need to. Sometimes the 6mm is too big, and you can actually cut these to size, have some smaller ones than this, and go after it. So if you have a low contrast lesion, that's the best way to go. Again, you're all getting exposed to that low contrast lesion to that spot that you're using. So you're not going to have a big burn, a big rectangle burn or anything like that. And it is tough. The lighter the spots get, I always tell patients that the great paradox in IPL is the lighter the spot, the harder it is to treat. I just had a patient today, we're doing a video visit, and like she was 80% better, and she said, yeah, but some of these are still here. And I said, yeah, we need to hit you again with it harder, but it gets harder. And I think for most patients, they think, well, if it's lighter, there's not as much pigment removed, how could that be harder? So I have to really explain that to them. Once I explain it to them, they kind of get it. And I also put them on a retinoid afterwards. I think long-term retinoid, even hydroquinone, more retinoids, I think you can lighten up some of those stubborn lentigos, but it takes months, not weeks.
Yeah, and I think sometimes they're not solar lentigos as well. I know when I'm educating, you know, I'll go back into a practice and they'll say, look, we just can't move these lesions. And if you have a look under them under a dermatoscope, quite often they're the very beginning of a SEB-K or, you know, an AK, which you're going to have to use another device for. So that's probably some advice that I would give to people out there watching as well, that if they are struggling, have a look at the lesion under a dermatoscope and just make sure that it's not the beginning of a SEB-K or an AK.
That's true. A lot of them are SEB-Ks and AKs, and then we just take our AccuPulse with the little handpiece. They'll use the little silk touch, feather touch with the fine touch mode, and we can knock those right out. But it's hard to do that with the, or you can use a hypercator, but that's the easy way to get some of those that are still hanging around. But you're right, if they're misdiagnosed, they'll never go away. And we do have patients who have AKs, and the redness is associated with the AK, so the redness comes right back. And I say that's because the actinic keratosis is causing the redness. So you either have to use FEDX or CO2 laser or something else, PDT, for example, to eliminate those precancers. Then we'll come back and mop up things either in the same session with the IPL. And we do a lot of combined IPL PDT. That's a common procedure we do. We do the IPL first, and then we do the PDT right after that. I know Mitch Goldman does the same thing with the M22.
Yeah, definitely, with great success. Well, thank you so much for your time today. The presentation and your Q&A has been absolutely fantastic. We really appreciate it.
All right, well, thanks, Rhiannon. Enjoyed being here. Y'all have a nice rest of the day there in Australia.
Thanks so much, guys. We really appreciate the very interactive Q&A session. And Dr. Ross, thank you so much for your time and your very thorough and informative session. We've just hit our hour time, so I'm going to close out the webcast now. Thank you so much to everyone for joining us.
Okay, thanks, Tracy. Thanks, Rhiannon. We'll talk to y'all later.
Bye.
Bye-bye.